Ever wondered why your gums are screaming for help? It's not like they have vocal cords, but boy, they sure know how to make their presence known. Every time you brush, there's blood. Every time you floss, it feels like you're auditioning for a horror movie. Those aching, swollen gums aren't just a minor inconvenience, they're a cry for help. And guess what? I'm here to decode that SOS signal for you. Your gums, my friend, are begging for some TLC. They're the unsung heroes of your mouth, holding your teeth in place and standing guard against bacteria. But sometimes they need a little help to stay healthy. Many people don't realize they're dealing with gingivitis until it's too late. Let's get started. It all started one morning when I was brushing my teeth, minding my own business. Suddenly, I noticed my toothbrush looked like it had been used in a vampire movie. Blood everywhere. My gums were on strike, and they weren't going to take it silently. I ignored it at first. Maybe it was a fluke, I thought. But the next day, and the day after that, the same thing happened. My gums were giving me the silent treatment, but their message was loud and clear. I needed to do something, and fast. That's when I realized I'd been brushing my teeth the same way for years, without giving much thought to my gums. Who knew these pink flaps of flesh could be so demanding? So, I started researching, reading everything I could about gum health. Armed with knowledge and a new toothbrush, I set out to conquer my gum problems once and for all. Now, you might be wondering, what on earth is gingivitis? Is it some kind of exotic disease? Not really. It's actually one of the most common oral health issues around. In simple terms, gingivitis is the inflammation of the gums. Sounds fancy, but it just means your gums are red, swollen, and might bleed when you brush or floss. The main culprit behind gingivitis is plaque, a sticky, colourless film of bacteria that constantly forms on your teeth. If you don't remove it through proper brushing and flossing, it can harden into tartar, which only a dentist can remove. Once plaque turns into tartar, your gums get irritated. They start to swell, turn red, and become tender. But don't worry, gingivitis is completely reversible. With a little bit of effort and the right techniques, you can get your gums back to their happy, healthy state. So, how do you know if your gums are throwing a tantrum? Well, they're not exactly subtle about it. The symptoms of gingivitis are pretty hard to miss. First up, there's the bleeding. If your toothbrush looks like it's been through a war zone every time you brush, that's a big red flag. Next, there's the swelling. Healthy gums should be pink and firm, not red and puffy. If your gums look like they've had an allergic reaction to something, it's time to pay attention. Another sign is tenderness. If your gums hurt when you touch them, they're definitely not happy. And let's not forget about bad breath. If your mouth smells like a garbage disposal, even after brushing, it could be a sign of gingivitis. So, if you've noticed any of these symptoms, it's time to take action before your gums stage a full-blown revolt. Alright, now that you know your gums are in distress, let's talk about how to fix this mess. Brush your teeth properly with a soft bristled toothbrush for 2 minutes, twice a day. Don't forget to brush along the gum line. Next up, flossing. Flossing removes plaque and food particles your toothbrush can't reach. Home remedies can also be effective. Rinse with salt water to reduce inflammation. Stick to your new routine and your gums will thank you. Let's take a moment to appreciate the fact that brushing your teeth is basically a workout. Think about it. You're using your arm muscles, you're concentrating on your technique. If you've ever watched a toddler brush their teeth, you'll notice they treat it like a full contact sport. Toothpaste ends up everywhere, on the mirror, in their hair, and somehow, even on the dog. But as adults, we're supposed to have this down to a fine art. Brushing your teeth isn't just about scrubbing away at your molars like you're trying to clean a stubborn pan. It's about gentle, circular motions that massage your gums and remove plaque without causing harm. So, the next time you pick up your toothbrush, remember, you're not just cleaning your teeth, you're giving your gums a mini spa treatment. Hold on to your toothbrushes, folks, because I'm about to reveal an unexpected remedy for gingivitis that you probably never considered. But before we get to that, let's talk about something equally important: your diet and lifestyle. Stay tuned because this surprising remedy will blow your mind. You see, what you eat and how you live your life plays a massive role in your gum health. You can brush and floss all you want, but if you're not paying attention to your overall lifestyle, you're fighting an uphill battle. So, let's dive into the dietary and lifestyle changes that can help you keep gingivitis at bay. And don't worry, we'll circle back to that surprising remedy soon enough. Trust me, it's worth the wait. Believe it or not, your diet and lifestyle are the unsung heroes when it comes to fighting gingivitis. Let's start with the basics. Sugar is not your friend. Sugary foods and drinks create the perfect environment for plaque to thrive. So, cutting back on sweets is a good first step. Instead, load up on fruits and vegetables. Crunchy fruits and veggies like apples and carrots can help clean your teeth naturally. They stimulate saliva production, which helps wash away food particles and bacteria. Plus, they're packed with vitamins and minerals that support gum health. Hydration is another key factor. Drinking plenty of water throughout the day keeps your mouth moist and helps rinse away food particles. And if you're a fan of green tea, you're in luck. Green tea contains antioxidants that can reduce inflammation and promote healthy gums. Sometimes, despite your best efforts, home remedies just aren't enough. That's when it's time to call in the big guns, your dentist. Professional treatments can give your gums the extra help they need. The first step is usually a professional cleaning. Your dentist will remove all the plaque and tartar. It might sound intimidating, but it's usually painless. In some cases, your dentist might prescribe an antimicrobial mouthwash. Most people can get their gingivitis under control with a professional cleaning and a good home care routine. Let's take a moment to talk about the dentist, your frenemy in the battle against gingivitis. We all have that love-hate relationship with our dentists. On one hand, they're the superheroes who save our teeth. On the other hand, they're the ones who wield those scary-looking instruments and ask us questions while our mouths are full of metal. Going to the dentist can feel like visiting a medieval torture chamber. But despite all that, we know deep down that our dentists are just trying to help. And let's be honest, they've seen it all. So, the next time you're in the dentist's chair, remember that they're your ally. Now let's circle back to that surprising, effective treatment I mentioned earlier. Ready for it? Drumroll, please. It's oil pulling. Yes, you heard that right. This ancient practice is making a comeback, and for good reason. Oil pulling involves swishing a tablespoon of oil, usually coconut, sesame, or sunflower oil, around in your mouth for about 15 to 20 minutes. It might sound strange, but oil pulling can help reduce plaque, whiten your teeth, and improve your overall oral health. The oil acts like a magnet, pulling out bacteria and toxins from your mouth. Just make sure you spit the oil into a trash can, not the sink, to avoid clogging your pipes. To try oil pulling, simply take a tablespoon of oil and swish it around your mouth. making sure to push and pull it between your teeth. Do this daily, preferably in the morning before you eat or drink anything. So there you have it, the ultimate guide to fixing gingivitis. We've covered everything from the basics of what gingivitis is, to the symptoms and treatments, and even some surprising remedies. Your gums have been crying out for help, and now you have all the tools you need to answer their call. Remember, the key to healthy gums is a combination of good oral hygiene, a healthy diet, and regular dental checkups. Brush and floss daily, cut back on sugary foods, and stay hydrated. Don't forget to visit your dentist for professional cleanings and advice. And if you're feeling adventurous, give oil pulling a try. Your gums might be small, but they play a big role in your overall health. With a little bit of effort and care, you can keep them healthy and happy for years to come. So, take action today and give your gums the TLC they deserve. Let's end on a high note, shall we? Here's a little joke to send you off with a smile. Why did the dentist become a baseball coach? Because they know the drill. Okay, I know it's a groaner, but hey, laughter is the best medicine, right? In all seriousness, taking care of your gums isn't just about avoiding pain or bad breath. It's about embracing a healthier, happier life. So, keep those gums in tip-top shape, and you'll be ready to face the world with a bright, confident smile. And if all else fails, remember, your dentist is just a phone call away. Here's to healthy gums and a lifetime of happy, pain-free smiles. Cheers!